All right, thanks for joining us. I'm Ernest Lunning with Colorado Politics, here with State Senator Barb Kirkmeyer, one of the whole lot of Republicans running to be Colorado's next governor. She's going to be answering questions today prepared by AARP Colorado. We'll be asking the same questions to the other candidates who are also running in their party's primaries next year for the chance to take over in 2027 after term-limited Governor Jared Polis leaves office. Barb, please take a minute to introduce yourself. Tell our viewers why you're running.
So I am State Senator Barb Kirkmeyer, and I'm running for governor of the office of State of Colorado because, I just really truly want to make a difference. What matters in this state to me is just to ensure that, we get past the unaffordability parts, that we become safer in our communities, we protect our kids, and that, gosh darn it, we fix our darn roads. That's an issue as well. But there is so much that needs to be done here, and enough's enough. Over the course of the last 7 years, we have had one-party control in this state. They've controlled the governor's office, the House, and the state Senate chambers, all three of those areas. And they have driven us to being where we're like off the cliff, basically, where we're unaffordable and we're unsafe and just unraveling in our state. So I want to make a difference. I want to get us back on track, change that, and make it so that people understand that our best days are ahead of us and not behind us.
We'll go with our first question here, and it involves caregiving. New data shows that there's more than 1 million family caregivers in Colorado. What kind of policies or legislation would you champion to ease caregiver burdens?
I think, first of all, we need to look at our rates that we pay to reimburse providers and even look at caregivers. And I know, we're talking with AARP and their questions here, but it's in all realms of caregiving throughout the state. And just recently, the governor has cut what is called Medicaid provider rates, which is those reimbursements to providers in our system. And I think that's been a huge mistake, and it's made it more difficult. So for me, sitting on the Joint Budget Committee as a state senator, I look at those provider rates and how do we ensure that we stabilize our safety net, both where it comes to providing care, and that includes health care as well. So last year, I went across the aisle and partnered with Senator Kyle Mullica to pass what we called the Save the Safety Net bill. So to stabilize our healthcare safety net throughout the state. And that includes also caregiving as well. So I would continue looking at ways to find funding to do that, to ensure that we are looking at to ensure healthcare access for everyone in the state, regardless of their age, but also that we have funding in place for caregivers as we move forward in the state of Colorado.
In terms of livable communities, older Coloradans are not immune to the housing affordability crisis. What policy solutions will you seek to help Coloradans age 50 and older find and keep affordable housing?
Well, I'm going to rely on what I've already done and delivered for the state of Colorado and for both the elderly and basically anyone living in our state that's buying a house or wishes to purchase a house and then owns a house. So in the last few years, in 2024, not once but twice, I carried the legislation as the prime sponsor to cut property taxes. And that's huge. And not only did we cut property taxes, we also reaffirmed the Homestead Exemption Act for seniors. Yeah. And we put in there an additional provision for seniors again, same as for everyone else, that there was an additional $50,000 off the top of their assessed value that they would get taxed on. So I would continue looking for ways that I can work to ensure that we are cutting taxes so that people can afford to live in their homes, and that would be property taxes, work with them on that way. And then also, we need to look at the regulations that have been passed, the laws that have been passed that bring on these overburdensome regulations that increase the cost of housing in our state. Specifically the building codes and the energy codes, they've increased the cost of housing to the tune of about 30% more when you go to build back in. And then lastly, there's this other law that was passed a few years ago about construction defects. And what it has done is made it nearly impossible to build condominiums in the state of Colorado. And those are kind of our first step into home ownership, or maybe our way of downstepping as we get older, because I'm getting older, and to make sure that folks have the ability, that there are plenty of condominiums being built in our state, and have the ability to downstep into something that is smaller size, that works for them, and that they don't have so much maybe yard maintenance to do that type of thing. But we need to really work on that construction defects law and get it into a place that works for everybody in the state, where we go back to building more economical things, buildings like condominiums.
Okay, next, as the number of Coloradans over the age of 50 increases, What can be done to help them age in place and remain in their communities?
And again, I think this goes back to some of the answer that I said in my last question with regard to the construction defects and, really going back and changing that law to ensure that there is the development of, smaller homes, lower, kind of being able to step down and not have so much maintenance around. So we need to really go in and fix that construction defects law to ensure that we are able to build townhomes and condominiums, and smaller homes that then seniors can move into and stay in place. And it's not just in the urban areas that we need to be thinking about. It also is in the rural areas. I live out in the rural areas, and I remember my in-laws, we had a dairy farm, and I remember my in-laws basically moving into town is what it's called out there. And again, there needs to be those easy facilities and to be able to move into, but then back to that Senior Homestead Exemption Act where we were trying to make the Homestead Exemption Act and that tax exemption portable. We got to it where it was a temporary portability, but we need to be working to make sure that it is permanent portability, that once you've made the 10 years living here in the state of Colorado and as a senior, you would get then the homestead exemption, that you would be able to move with that. So when you're trying to downsize, that you would be able to take that exemption with you to a smaller home.
Well, thank you. And in terms of healthy living, what do you see as the biggest public health challenge facing the state, and how will you address it?
The biggest public health challenges, and it's going to sound crazy because I'm a fiscally conservative Republican, but it's the cut of the reimbursement rates to the providers, to the hospitals, the doctors, the behavioral health clinics, the other clinics throughout the state. But over the course of the last 7 years, we have systematically just kept decreasing the amount of funds that we pay to providers, to reimburse providers. So they're getting somewhere around 50 to 60 cents on the dollar for the services that they're providing. So they can't stay in business. And so we have hospitals that are closing certain services. Like, for example, just in the last couple of months, we had hospitals in northern Colorado, in Loveland, close their emergency center and their inpatient services. So I think that is the biggest challenge that we're facing here, is that lack of reimbursement on Medicaid and then also even Medicare. And what it's doing is driving hospitals to close certain businesses, certain portions of their hospitals. And that cuts access and jeopardizes access for everyone in the state of Colorado.
From a legislative perspective, what can be done to improve our state as a great place for fitness, health, and well-being for Coloradans of all ages?
Well, we've talked about the health programs and such, but we live in a great state that has this tremendous outdoor, amenity that we have here in Colorado. And so as a member of the Joint Budget Committee, I have been working with and I'm not going to say fighting for, but certainly funding for our great outdoors, and to make sure that there are programs that are in place for every age, that they can go out and build, pathways and walkways and be able to enjoy the great outdoors, whether it's in fishing or whether they're hiking or whatever they're doing. And I will tell you, even as a county commissioner, because I served as a Weld County Commissioner for 20 years, I was part of creating the St. Vrain Legacy Trail, which is also part of the Front Range Trail system. And we were able to get close to a $12 million grant from GOCO to devise this trail throughout all of Weld County and parts of Larimer, Boulder, and Boulder County. And it's just huge for people to be able to get out, enjoy the outdoors, but at the same time really increase their health. And everybody gets to use that path and that trail.
Turning to financial and consumer concerns that the ARP wants to talk about, the state legislature is tackling major consumer safety issues as technology rapidly evolves and changes, such as guardrails when businesses and governments use AI to make major decisions that impact people. What's your philosophy on balancing consumer rights and technological innovation?
And you're right, there does need to be a balance between consumer rights and privacy, data privacy, and we should be able to protect our own data as individuals and make sure that it's not being out there all over the place as these new technologies come in place like AI. And as you know, down at the Capitol, man, this has been a struggle. So I have been pretty actively in working with Senator Rodriguez, not as a sponsor on his bill, but just working with him to ensure that we are getting the right balance, that we have all of the right people at the table to have the discussion, whether it's the venture capitalists or the big tech companies like the Amazons and the Googles and those types of things, but have everybody at the table so that we are protecting not only our privacy and our data privacy, but the consumer rights, and make sure that we aren't discriminating and using it in a discriminating way. But we need to have this technology and we need to use it. And there needs to be a discussion about if you're the developer or if you manipulate the programs, then do you become a developer? That seems to be the biggest hang-up that we're having down at the state capitol. How do we get that defined and how do we make that work? Because again, whether we're in state government or as a county commissioner, we looked at things where we pulled them off the shelf, and then if we manipulated them, we would become liable for, different things within that program. And so we've got to look at that balance.
Okay, groups like AARP consistently hear from members that rising utility costs pose affordability challenges for Coloradans on a fixed income. Additionally, inadequate heating and cooling can cause significant health risks for older Coloradans. Colorado gets hot, Colorado gets cold. As governor, how would you balance competing interests, clean energy targets, data centers, et cetera, and ensure affordable utilities for older Coloradans? It's a big question.
This is interesting. This is a big question, and hopefully I can get it done within 1 minute as you're asking me to do. But here's the thing. Just recently, the Public Utilities Commission went and put in a new rule and approved a plan that would require us to get faster to the 2050 plan of decarbonization, but by reducing natural gas. Huge mistake, and as governor, I would appoint people to the Public Utilities Commission that would go in and repeal that and draw that back. It's not that I'm not for clean air. I think everybody is, and I think my record demonstrates that I have been for clean air, clean water, and a clean environment in the state of Colorado. But at the same time, forcing us off of a clean, reliable, sustainable energy source called natural gas to go to non-renewable, unsustainable, unreliable, and more affordable wind and solar is just ridiculous, and it is going to drive up the cost. It'll drive up the cost that the utility companies have to do to build that infrastructure out, and eventually it will drive up the cost to the ratepayers, which is everybody, not just seniors, not just people on fixed income and low income, but everybody.
Thanks. Colorado has established a first-of-its-kind Prescription Drug Affordability Review Board to research and review the cost of prescription medications to consumers, even set upper payment limits on certain medications. Do you support this PDAB? And how do you plan to further ensure that medications are affordable for older Coloradans?
Sure, and I do not support the first of its kind Prescription Drug Affordability Review Board. And in fact, there are several other states who started this program before Colorado did, and they haven't gotten theirs up and running. We were very aggressive here in the state of Colorado, but basically it's been in place for about 4 to almost 5 years now. They have put an upper payment limit on one drug, and it was a rare disease drug, which I think is just a huge mistake again, and it just needs to stop. It's not working. It's costing us as a state a lot of general fund money, which, as you know, where our budget situation is, not a good thing. And so we need to get that into a place where it's not causing people so much angst and consternation with regard to whether or not they're going to have access to their drugs. So to me, this Prescription Drug Affordability Board basically has not been working, and it's been causing problems where we are now jeopardizing access to needed drugs that people have in our state. And they'll have to move to get those drugs. So I think the other thing is I have demonstrated even through some of the bills that I've voted on and support on that I'm certainly in support of how do we lower prescription drugs throughout the state of Colorado. And I can't remember the name of the bill, but it was sponsored by Senator Joanne Janal a few years ago and worked on that bill and how do we get drugs in from either Canada or other places. But I think there are other ways, looking at the 340B program, looking at prescription benefit managers. How do we make some changes there? I made a change in state law for state government insurance to make sure that our prescription benefit manager was getting paid a fair amount, but not overpaid and not getting to keep all the rebates. And that ended up saving us money on our state program of insurance, for our state government folks. And I think it's something that we can transcribe across the system.
Thank you, Barb. I appreciate your taking the time to talk with us and help our viewers better understand your campaign, what you're running on.
Well, thank you very much. I appreciate that. And hopefully your viewers will follow me either on X or Facebook or go to my webpage account, which is kirkmeyerforcolorado.com.
Please check out our interviews with the other 8th Congressional District candidates and candidates for governor on coloradopolitics.com and at AARP Colorado. Thanks for watching.